What is your take on all of this coming from like a medical professional?
Knowing too much in a sense, it's a burden in a sense. It's just like, oh yeah, I'm telling my mom, we're not going outside at 2 weeks. Yeah. Having your family members call you all the time about every symptom. It's like, oh, I have a cough or a headache. It gets overwhelming. You know, being specialized kind of sucks in a sense because I feel essential but not essential. Because people are out there like really fighting to save lives. Wish I could help more.
Right. You know, that feeling comes sometimes like throughout a cosmetic career, I think in all aspects.
Yeah.
You feel important because those people think you're important. I'm glad I get to do that for somebody, but then it's like there are so many other jobs out there that it's like their life or death.
When I got into this field, like my primary goal was I love making people feel better. So
shift the focus. It's hard to, especially when you know too much.
Yeah.
But I think like shifting it to, we are making people feel better right now in the way that we can. Right now, all these people who are joining in, they're home. They're like, their fillers are looking all funky. So we can at least help with that at the very least. We can help the healthy. So doing things for my appearance is good for my mental health. People have depression too. I mean, being locked inside like this right now is not good. I mean, definitely difficult for everybody to find like motivation these days. Guys, like this is the first time I'm not in pajamas in like 4 days.
I have to do it.
I'm not leaving my freaking house. So I'm like, you know, I roll out, like when I do shower, I'm just changing into new pajamas. Like my husband's like, you should just be wearing pajama pants on the bottom. Right. I know, I really should.
I thought about it. So my name is Jima. I'm a physician assistant, and my background is in plastic surgery and dermatology. Not only just treating rashes and other skin ailments, but also doing injectables as well, which includes Botox filler. So it's great that your injector is not just an injector.
I mean, these cosmetic situations can easily turn into a medical situation very quickly. And if you don't know what you're doing in that situation, you might be able to make someone look great, but
but you need to be able to save their lives. So,
I want you to know how to save my life and give me plumping lips.
So as far as Botox and injectables go, Botox is runs on the spectrum of anti-wrinkle, right? So it stops muscle movement. And when it comes to filler goes where you need volume.
Usually when we do our events, we have our Botox parties and champagne and mimosas.
Yes.
And I find that that's a good one because it's super light and you can have one, you know, nice little glass of champagne and be okay. And then most of the time I do try to stick to mimosas because it's mixed with that orange juice. Yeah, so we are definitely careful about, you know, our parties and what you're actually able to consume so that it doesn't affect your service. I'm the one pouring your drink. So I know how much you're drinking.
Right. We don't trust, not that we don't trust you, but
I don't trust you. So what are some things not to do after getting Botox and filler?
One, you want to make sure you're not exercising. You want to make sure that you're not going to go get a massage, and you want to stay upright as much as possible. Go home and start to manipulate things. And once again, you can take the arnica. Of course, if you have a high chance of bruising.
Had my Botox. It was super hard for me not to mess with it because it felt so weird. Look, I'm lifting my eyebrow right now. You can't tell. So how long is it before you see results?
As far as Botox go, typically results are within 2 weeks' time. It's like wearing a bra.
It's literally a bra for your forehead.
Yeah.
It's a bra for your forehead.
Filler, results are immediate. However, you have to account for swelling. So of course you have to give that a couple of days.
So we have a question. Where do you find the most popular area that people get filler is?
I would say the lips. Lips are, it's the most advertised.
Yeah, young people want them bigger. Older people need the hydration, and it helps like smooth out their fine lines.
Wrinkles around the mouth as well.
And how long do results of each of those services last?
So on average for Botox is 3 to 4 months, but for filler it could be 6 months to even 2 years.
The more thick the filler is, the longer it's gonna last. Have you done like the jawline or the nose? I've been seeing that a lot.
So I have done jawline, it's not as common, but most injectors have done jawlines, but noses, not necessarily, because it's a very high risk area. So you want to definitely weigh out who your patient is and is it worth doing.
Are there any like complications with Botox and fillers?
Bruising. So bruising is probably the most common complication that one can get. Lesser extent, you can have infections. Making sure that we're cleaning the area before we inject. So there are a couple of things that we do to prevent. We pull the syringe backwards to see if blood comes into the syringe. And then secondly, there are other things such as Hylenex is a product that is used to remove or dissolve the filler. And so of course we are just as careful as.
And just so everybody knows, we have Hylenex on hand at all times in case of emergency. So if there was ever a situation where, you know, your filler needed to be removed, if you had some kind of reaction, it can happen on the spot immediately. If they are prone to having cold sores, will they get a cold sore with getting lip injections?
So it may or may not happen. It's not like a huge chance that, okay, every time I get lip filler, I'm going to get a cold sore.
What type of treatments do you offer for under eye puffiness?
Okay, so under eye is actually a very tricky area. You really need to be assessed for under eye filler because it really depends. Like if it's a loss of volumization, but if it's just darkness, shadowing, it depends. Under eye filler is not for everyone. There are a few products out there that are decent for under eyes.
And they do have a product that works like phenomenally on the under eyes, which my best friend is actually using. The results that they have had, and it seems like an amazing product. So sometimes maybe even using something like that, or even getting something like micro needling. It just depends on what, you know, the
and then that
actual
gets
problem
as close.
is. I mean, sometimes when you have discoloration under the eye, it's just broken blood vessels.
Right, that too.
So that's not going to help in that
right, the
case.
filler would not help in that case. Right.
What areas can fillers be used?
A lot of areas. So let's see.
Lots.
Lips, we know, of course, a very common area. So we call it nasolabial folds, which are here and here. Mine may not be prominent because I've had it done there, but
me too.
So that area, of course, the cheeks. We mentioned jawline before.
I have to be 40 plus to get Botox. Like, absolutely.
Right.
Yeah.
You want to do it preventatively. Your lines are really deep when you're at rest and not making any motion. So then what we'll do is sometimes we'll use one of the less viscous, less thick fillers to do some lines. And this is another high risk one as well because of the blood vessels in the forehead. You don't necessarily want to have to get that, so get the Botox before you need it.
I mean, I'm 27 and this was my first year getting Botox. I definitely think like I could have even started a couple of years ago. But I love it. Like you don't even realize that you're in your 20s. You don't even realize the difference that it's going to make. Your wrinkles are not that prominent, so you don't really see that they're a serious issue. But like once you get rid of them, you're like, shit. And is it painful? And is there anything that is used for the pain?
I can't say that it's not necessarily painful. Once again, it's going to depend on pain level. You know, a lot of the lip fillers, they actually have lidocaine in them. So as you move along, it gets easier.
We're both ready to leave. And she was like, all right, let's do this really quick. And I just didn't want to wait. She didn't want to wait for me to numb. So we kind of just went for it. And we did like my cheeks. We did my Botox. We did my lips. We did all this stuff. And like, I was not numb for any of it. And I'm a baby. So if I can deal with that, then you're fine. That says, are fillers safe and what's in it? So I had a lot of people actually ask that question for parties and stuff. Because they're like, well, I don't want to put this foreign substance in my face.
It's hyaluronic acid, and that's actually a component that is found already in the skin, which is why it is safe because of the substance that it's made out of. It's a component that's found within the skin already.
How many units does the average person need?
And I think that's the one thing that people typically call in and say, like, how many units will I use?
How much does it cost? Yeah.
Right. How much does it cost? How many units? You have to come in because we have to test to see how strong your muscles are. And it's a per person evaluation. And only then, unfortunately, we could tell you how much.
If you do have fillers and Botox right now and you can't, and you're due for them, you can't go in and get them, what can you do right now? It's going to last as long as possible.
As far as the Botox goes, you want to think about anti-aging things. Going outside, of course, you want to make sure that you're using sunscreen. Even if you're going to sit by the window for long hours, along with your mask, wear a cap. As far as the filler goes, hydration is key. So you want to make sure that you're drinking enough water, whatever amount of ounces per body weight, or do your 8 glasses if you're not sure. Taking zinc actually helps maintain your Botox longer. Right. You don't want to overwork those muscles.
Right. When you're working out, you know, try not to like
Scrunch your
Scrunch
face
your face.
up.
To go out in the sun, wear a hat so that way you're not squinting because of the sun. Just forever look like a bitch because then you don't have to make any facial expressions.
Right. Just keep that rested face and you'll be okay. And as far as the filler goes, trying to not manipulate. You want to make sure you're moisturizing twice a day. If you have a humidifier, that would also be good to keep the air in the home moisturized. So that increases the moisture inside of the actual filler as well. So that's how that process works. You want to make sure you're not laying down on certain areas. Also, that's another key for preventing wrinkles. If you tend to sleep on one particular side, you do tend to form more wrinkles on that particular side. Don't get any deep massages. You want to make sure that you have no drastic weight loss because that also, we talked about metabolizing filler.
Stress, I read too.
Oh yeah, and it's hard to tell you not to stress.
Yeah, like just don't stress. You're ruining your Botox. So like I was saying before with the eye thing, that line that I actually have launched now on my website, they also have an anti-aging moisturizer, which is medical grade. It uses 3 different forms of hyaluronic acid. Right. So that's the thing that we use in fillers. So if you are looking for something in the meantime to like firm and lift your skin and you're not really sure about the products that you're using or if they're working, that is something I definitely recommend checking out on our website. They actually call it the topical Botox. So very, very good to use in the meantime. Another product that I'm going to talk about a little bit is for lips. So if you can't get your filler right now, or, you know, you've been thinking about trying filler and, you know, now you can't, the Skin Medica HA5 Smooth and Plump Kit. All of the lip plumpers out there, I've never really been a fan of them. They don't last long. They kind of just like burn your lips. This is actually really good. This is also medical grade. That's a really good one. It smooths fine lines. It plumps your lips. It lifts them. Does all that good stuff. That's also on our website. So I am going to do a home remedy now for a lip plumping scrub. This is obviously not something that's going to like last a long time, but it's something that you can do, you know, around about to take a selfie and you're like, my lips look really small, then you can feel free to do this using cinnamon, cayenne pepper. Use Vaseline, Aquaphor, any like petroleum based. It's very moisturizing. I also really like it because of the consistency. If you don't have any petroleum products, then you can use an oil. Also, you don't have to use cinnamon and cayenne. You can actually use one or the other, but I have both, so I'm just going to use both. And I have this really tiny spoon that's from my daughter's tea set, and I was like, this is so perfect. Don't use too much of that.
Right.
Cinnamon too. And then you're just going to mix it together. And then afterwards, you're just going to put on like your favorite chapstick. Use my finger. I'm just going to rub it on my lips. And then I'm going to let it sit for a couple minutes. Ooh, sexy. It's kind of nice exfoliator. Cayenne, ooh, spicy. Yeah. We're trying to irritate those lips. And they do. They look like, they already look more plump. That's a plump lip. Yeah, and I don't have lipstick on you, so let me wipe it off. Yeah, man, that looks bomb. They actually do look really good. But hell yeah.
And it's a good color.
I know, right?
Yeah.
I mean, color. This is natural, this color.
Yeah.
A lot of lip plumpers do that. They do give you like a really nice, pretty, like rosy color because it rushes the blood to your lips.
Right.
The plumper I was talking about, that does that as well. It gives you like that pretty color.
Oh yeah.
So you can see like a visible, visible difference. And it looks really pretty. I don't recommend things to you guys if I don't think it's good. And this is that Illuminate Young base stuff I was talking about. I actually posted this too today.
Yeah, I did see that.
That's amazing.
Yeah.
I've never seen like a topical thing do that.
Right.
So,
they typically, their line is pretty good. Yeah.
Yeah. I just, I'm wiping it off now. So I had it on for like, I don't know, like 3 minutes. I'm sure it'll probably last like up to 30 minutes. Even that might be pushing it. Definitely make sure you're not putting like a ton of that cayenne.
Right.
If you do want to put more of something, put more cinnamon.
Right. Not the cayenne. No one's going to the ER.
Yeah. Don't be like, well, they do it on Instagram.
Not like, yeah.
What was that lip color you put in there? I missed that. I didn't put a lip color. This is my natural lip color reaction to the mixture that I put on my lips. Cinnamon and cayenne. Yeah, that's the lip color. Cinnamon and cayenne. We're going to be on here next week. We're going to be talking about hair removal and waxing and stuff next week. Thank you so much for getting on here. I know everybody appreciated your intelligence.
Oh, thank you.
Bye, guys.
Bye,
Thank
guys.
you.
Bye.